So this is Dr. Taylor DeBusk on Behind the Double Doors today. And today on the podcast, my guest is a patient who has a remarkable story, and we're honored that she's willing to share it with our audience and for those who are thinking about doing the same thing. Welcome, Hannah. Tell us a little bit about yourself.
Hi, I'm Hannah. I was just a patient of Dr. DeBusk's like a month and a half ago. I live in Los Angeles pretty much. I'm 40 minutes out of Los Angeles, and I flew across the country to go to Dr. DeBusk. So I had a rhinoplasty, and I hated my nose for a very long time. So I'm really happy that he was able to kind of bring my goals to life, and I'm excited to tell my story.
And I'm honored that you chose us. You have a lot of different plastic surgeons and facial plastic surgeons on the West Coast, especially the LA area. So we are humbled that you decided to come all the way out here down to South Texas. Um, but about your nose specifically, can you tell us what was bothering you or what were your areas of concern?
Yeah, so I'm gonna pull up some pictures of me before to kind of show everybody what that looked like. So right here, you can see I had like kind of a bird beak looking nose. That's what I like to call it, but it's a little harsh. I had a dorsal hump on the bridge of my nose, and I wouldn't let
Mhm.
anyone record the side of my face. I wouldn't take pictures of the side of my face. This is the closest I can get to finding proof of that. Here's another one that kind of shows it. You see, like my nose is drooping.
Yeah. Well, you had what's called a dorsal hump, which,
Yeah.
if or convexity. It was a fine nose. I wouldn't say bird beak, but it had that kind of stereotypical bump on the nasal bridge.
I loved it head on. Like, seriously, I didn't really mind that you could kinda see the bump from the head on. It was just when I turned to the side that I don't have any photos of the side of my face, like, straight from the side before, because I cried every time I saw an image of me at that point. And here, another doctor took some photos of these whenever I was first starting to consider rhinoplasty. This was a doctor in San Diego, closer to where I'm at now, and she got she got my worst angles for me. So, which is a good thing because now we have proof of what it looked like. Um, but yeah, you can this shows it a lot better. And then there was one more.
Yeah.
That also there you go. That's it. That was my nose.
And I know, and again, it wasn't a massive hump. I think one of the things with your nose is that you had a couple sharp angles right on the nasal bridge. So
Right.
whenever, the light hit you and created those shadows, I think it really accentuated and it made kind of those harsh transitions, especially from like the nasal bones down to the cartilage and from the cartilage down to the tip. Let's see, how do you think the appearance of your nose affects your day-to-day life now that a lot of the acute swelling is gone and we're getting a good idea of what the final product is?
Oh my gosh. It's insane. Like, I take pictures of every angle of me. I let my friends take videos of any angle of me. I let my boyfriend walk on either side of me. I used to be like, "You have to walk on the left side of me because the right side is my bad side, and I don't want you to see me like that." And actually, I was just with him yesterday, and he was about to sit on that side. I'm like, "Wait." And then I was like, "Oh, wait. Go ahead. I don't have a bad side anymore." So it really and my family is gonna come for Christmas in less than a month, and that's gonna be the first time they get to see me in person with, like,
I know.
total confidence.
I'm excited
Um,
for you.
and I'm so excited, and that's definitely gonna impact how I present myself in front of them. Like, I feel like they're totally gonna see how much more confident I am now just by the way I carry myself. Uh, it I did cry whenever the swelling first started to go down because I was like, "Wow, this is really what I've wanted for since I was like 11 or 12, and it finally came true, and I didn't really know if it was ever going to." So,
Yeah, and I'm so happy for you. I mean, I think that the biggest thing is it really is the boost of confidence. A lot of people, even now, today with rhinoplasty consults, a lot of people are, worried about, people thinking they had a nose job or rhinoplasty or thinking that they intentionally tried to change the shape of the nose. But in reality, I mean, this. the surgery is for you, and it is to boost your confidence or make you feel like the best version of yourself. Not like a different person or a different version, but the best, the most confident version of yourself. Because we did make some subtle changes with that made a pretty impactful overall change or result to the nose, but you still look like you. You don't look like a different person. So that's always the goal
Yeah.
is
That's why I chose you, but we'll move on to that later.
get. Well, good. So I guess for everybody listening, how long ago did you have surgery?
And I had it on Friday the 13th of October. So I was like, "Oh, what a bad day, like a bad luck day or whatever." But yeah, it's been like a month and a half, and he told me, since I have such thin skin, for everybody who's listening, that my swelling wouldn't really be quite as bad as people who have really thin skin or thick skin. And he wasn't lying because I only really see a lot of swelling on the tip of my nose at this point, and it's not even a lot anymore. Um, I so like a month and a half, and I'm already loving my nose.
Good. I know, and I think that that's a really important thing for people um, just listening is that the thickness and the quality of skin makes a really big difference in rhinoplasty. And for you, you have fairly thin skin, which people that are listening and watching can see on your before and your afters that you'll show. But that makes it even more challenging to get that desired result because any subtle changes in the cartilage and the underlying framework are much more visible in thin skin patients. So for you, we had to be very careful to make sure that we really good symmetric contour of the tip. And, you know, I believe we definitely got that, and we'll continue to see those subtle improvements. But you're right, we get to your swelling kind of resolved faster than the average person because of the consistency and thickness of your skin. I guess overall, since you are out on the West Coast, can you tell the listeners kind of how you stumbled upon our practice and how you found me and why you decided to undergo your rhinoplasty with us?
Yeah, so I work for the Axis, who produces this podcast, and so I've known Dr. Basu for a long time, and you started with him, and you started recording episodes, and I was editing podcast clips of you and writing descriptions of the episodes of you talking about rhinoplasty. And I was like, whoa, like this guy knows what he's doing. And it was the fact that you you had the past of restructuring noses after like removing cancers and stuff. I'm like, so he has rebuilt noses basically. So like if he can do that, there's no way he can't fix my little bump on my nose. And do it safely in a way that it would be functioning really well as well, because something was making it kind of harder to breathe out of my nose. Um, and ever
Yeah.
since then, I haven't had that issue, but I just knew that you would be able to focus on not just the appearance, but also that. And you did.
Yeah, no, and I think you bring up a good point about the breathing, and then kind of my background in head and neck surgery. But with every nose, we had to build it on a sound foundation. And I tell everybody that the most important thing with rhinoplasty is the ability to breathe, because we can make you the cutest, most amazing looking nose, but if you can't breathe out of it, you're not going to appreciate it. You're not going to like it. So breathing is kind of that number one paramount issue, but the look and form is right next to it. So that's what makes rhinoplasty so complex. And there's no such thing like we talked about in our initial consultation as a easy rhinoplasty. Even for you, like we just wanted to kind of straighten out the dorsum, modify the tip a little bit, but it's still a very complicated surgery. That's why it's important. Number one, knowing who you're going to, trusting who you're going to, and kind of relying on your gut before you choose your surgeon. And that's what I tell all patients. I mean, I think that, it's kind of taboo to say to patients, but I always tell people, it's important to kind of shop around or at least really kind of do your homework because you want to go to somebody who, you feel is comfortable, you feel is confident, and who makes you confident proceeding. And in speaking of, kind of because we first met virtually and we didn't really meet until the day before your surgery in person, what were your initial impressions during our virtual consultation and kind of, how did that go for you?
It was kind of like a sigh of relief because I've been wanting this for so long and I didn't really find the right person to make it happen. But then as soon as I spoke to you, I could tell you just even though I was really anxious, you were really calm about the whole thing. You're like, "Oh yeah," cuz you've probably experienced people with similar insecurities as me and helped them through it. So you seemed very confident. It seemed like you already had a plan in place almost. Even though you didn't see my nose in person, you kind of had an idea of what I would need just by looking at me on that
Hmm.
Zoom. I just felt calm and just confident that you were the right choice right from then. And the team that helped.
Oh,
Like
no, I appreciate it.
because
Yeah.
Jessica was also
I
really
think
helpful
here,
with everything, so
and I think you bring up a good point because this is nothing. It's not all on me by any means. I think from your experience, from the consultation to coordinating you flying cross country and hotels and the aftercare. I know you had your own friends that had come with you, and from our side of things, we have a whole team, including Jessica, who really try to coordinate and make this as easy and as painless of a process because surgery's scary and your primary focus is the surgery that's causing you a lot of stress. So our team here is really they're there to try and eliminate and reduce that. And I couldn't do anything without them, that is for sure, because this was your first major surgery. I mean, a lot of people are stressed about anesthesia or the surgery itself. Did you have any major concerns prior to the surgery?
okay, I made the mistake of watching the new Saw movie in theaters, like, a week before my surgery, and I wasn't nervous until I watched that movie in theaters on the big screen, and, the main character woke up during his surgery and saw them working on him
Mhm.
or whatever, and I was like, "Oh my gosh." I started to get, like, kinda nauseous in the movie theater. I was like, "What if that happens to me?" But then I knew that, like, your team would never let that happen, so I was like, "Whatever." But no, I wasn't nervous. I don't know.
No, that's good. That's good. I mean, you bring up a good point. A lot of people are stressed about anesthesia, and especially if you've never had surgery before. In anesthesia, people always reference movies where patients wake up in the middle of surgery. And nowadays, with the way anesthesia is performed and watching your vital signs and all these different things, it's virtually impossible to wake up during any sort of surgery. And we have our MD anesthesiologist with us here for every surgery, so all patients get, kind of the best of the best treatment and the best of standard care. So, but you being not nervous is shows how tough you are. That's for sure. Um, and then we kind of touched on this earlier about Jessica and our team here that kind of helped organize everything and or helped you organize the flights and all that process. Can you kind of tell me how that went and how that made your overall pre and post-op care easier, harder? How did that go?
Well, it's definitely a lot easier, I'll tell you that. I was more nervous about preparing for everything than I was for the surgery itself, but Jessica was like she talked to me like a friend. The first thing she did as soon as I said, "I want this," is she's like, "Alright, let me help you find flights." And literally, I think maybe no more than a week later, she's like, "Southwest is having deals right now. This is the time to get your flight." And then she helped me buy that flight like on the spot. And also she helped me find what hotels were nearby that were within my budget. And yeah, she was just really helpful with just planning everything.
When you're having surgery outside or you're having to go a kind of a destination surgery where you're going somewhere, especially out of state or cross country, most patients don't think about the pre-op, getting you in a day or two before surgery, having to stay in town for a week or two, depending on the surgery you have done. Um, Coordinating all of that is challenging, and I think that having our team here ideally and hopefully makes it a lot easier because we have a lot of patients from out of state, not necessarily from across the country. We have some international patients, uh, but we have a lot more patients from out of state these days, especially with social media and stuff like that. So people can kind of see our results and get to know us. without having to come in for a formal consultation initially. But our team here helps make all of that a lot easier. So, but yeah, I'm glad you brought that up because I think it's important for people to realize that I only do a very small portion of this, which is just the surgery. All the other
Okay, it's a
stuff
big deal though.
is the team. It is. And then another thing that I think is important for people to know is, you brought your friend Sarah with you to help you during your recovery. Tell us how she helped you, kind of support you, and tell us what her role was during that week.
When I first decided I was getting this, I thought I was going to be going through it completely alone. Like, I thought I was going to be in a hotel in Houston by myself, and I was kind of terrified. And then I started talking to Sarah about it, and she's like, "Hey, I'm down." And so Sarah ended up coming with me. She flew with me. She went to my pre-op appointment with me, and she was emotional support along that way because I was nervous the whole time. And then after the surgery, I knew that pineapples were supposed to like help you heal faster or something. I don't know. Sarah would cut up pineapples for me every day. I had a little like journal for my meds, and she would write down the schedule. It sounds like little things, but it made such a big difference. And just the fact that she was there, I felt so much safer. Um, Sarah definitely, I wouldn't have been
It
able to do it
does.
without her.
I think, we all need a Sarah. That's for
Yeah,
sure.
for sure.
But I think you're right. Having somebody there with you when you're out of town, out of state, cross country, because your body's going through a lot healing wise, and it's exhausting on you. So it's nice to have somebody for that emotional and physical support. Now during surgery, so this is all kind of before and how we got you to here, but kind of tell us about the day of surgery, and what was that like for you?
Yeah, I have a picture of me on the day of surgery. Boom. That's me right about to go into my surgery. Um, but the day of, it was super early. I think my surgery started at 8 or something like that. I was there.
Surgery started at 8. Yeah, so
I woke
you're there
up,
pretty
got there at
early.
like
6 between 6
7:15.
and 7.
Yeah. So I got
Yeah.
there really early. But I woke up, rode my Uber with Sarah, and Sarah went in the waiting room with her book, and I just went on in, and the team was super helpful. I don't remember their names, unfortunately, but they like put me at ease. The anesthesiologist including,
Yeah.
because I was like telling him about the movie I saw, and he was like, "Oh, no, 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 I'm there the whole time. I'm by your side. Don't worry about it." And then
Yeah.
I went into surgery. Don't remember any of that, obviously, but then I got out of surgery, and I had 3 angels waiting on me, in a car. I had Mary Ellen, Eva, and Sarah, who were all making sure I got to my hotel safely. But the actual surgery day, like at your office, it couldn't have gone any smoother.
Yeah, good. I know our nursing staff, the pre-op, post-op staff, intra-ops, everybody is amazing, and really, what Dr. Basu has created here is definitely top notch. Now, during and then after surgery, I called your mom to give her updates, and I called her as soon as surgery was over. Um, how did she feel about you getting the surgery? Was she excited, apprehensive?
Yeah. So at first she was like, I think you're beautiful the way you are, and God made you this way. Like, you should, I really want you to know that nobody's pressuring you to get this. But she's like, but I'm also really happy for you because I know that you really want this. Then when
Yeah.
she found out that I met a surgeon who I really trusted, then she was like, okay, for sure, let's do this. She was so supportive of the whole thing.
Yeah, she was amazing. I mean, I only met her. Well, I met her twice through phone,
Yeah.
but the first time I talked to her was right there after surgery, and she was very excited for you. She's like any mom, worried. I have kids that you definitely worry about them if they have anything invasive done. But now she was amazing, and I'm glad that she supported you through this whole thing because you're right. I mean, this really helped boost your confidence, which I think, to be honest, is the reason that I do these things. It's just amazing to see your response and how it makes you just feel better on a day to day. And then after surgery, for recovery, I tell everybody if you have like a physically demanding job, you definitely want to take that first week off. Working on the West Coast and being out here in Texas, were you able to work that first week? And if you were, kind of what did you do? And how busy were you from a work standpoint? Can you kind of tell us about that?
Yeah, so I actually was working the next day. I felt great. Like my mind felt great, even though my body was tired and sore. Um, and I was just kind of playing it cool. I'm a freelancer, and all of my coworkers were taking it easy on me, not pressuring me into anything. But pretty sure I joined a meeting the next day, and and they were like, "Oh my gosh,
Well,
you don't
good.
even really have
Yeah.
any bruises." I barely had bruises. They were like yellowy slightly at that point already. They were like light
Yeah.
yellow, and I didn't have bruises by like
Yeah.
day 3 or 4. They were gone. So, but yeah, working, my mind was sharp as a nail. Like I did not feel super exhausted. I mean, I did take like 2 naps a day while working just to help myself heal because I knew I needed it.
Yeah.
And I was a little bit tired, but I wasn't like
Yeah.
bedridden, exhausted
You're
like I thought I was going to be.
everybody responds different, and not everybody's going to do as well as you, and some people might do a little bit better. Um, but I think that a lot of people are very apprehensive of pain after rhinoplasty, and I tell most people it's really not that painful of a process, and a lot of other over the counter medications like Tylenol and ibuprofen can really manage it. Can you tell us about your pain?
Yeah.
How painful was it?
Yeah, I actually wanted to mention that. I only needed to take the strong pain medication for 2 days. And then I was able, like, after
Yeah.
that, I was like, all right, Tylenol, ibuprofen, let's switch between those every couple hours. And yeah, so the pain was like almost nothing to me. The only time I felt pain was when I first woke up from surgery and the anesthesia was wearing off. And then your team gave me
Yeah.
medicine as soon as I said something. I was like, whoa. But then ever since that, after that, I didn't really feel any pain in my nose. This was me the
Yeah, and,
day
it's
of
surprising.
surgery
A
when
lot
I
of
got home.
patients.
When I got to the hotel,
Yeah.
it looks painful,
Looking
right? I
good.
wasn't. This was me like 3 days into my recovery. You can see the barely no barely any bruises. But yeah, I
Yeah.
didn't feel bad.
No, you did extremely well. And, most people are surprised. And honestly, I don't think they really believe me when I tell them that, for the most part, it's pretty painless as long as you stay in front of the pain. You need to take
Mhm.
your Tylenol and ibuprofen as long as you have no contraindications, but you need to take it preemptively, take it before the pain really hits and sets in, because it will. You don't ever want to have to chase pain. That's when people get into trouble, and that's when things kind of get a little unbearable. But as long as you stay in front of it, typically it's a pretty easy process of recovery. And then how long do you feel like? I know we talked about this earlier because you have thinner skin and the swelling wasn't as long as you initially anticipated it. But how long do you feel like it took you to get back to feel quote unquote normal?
I think it's the exact amount of time you told me it was gonna be, 3 weeks.
Yeah. And that's what, because, your body's healing in those first 2 weeks. First week and then into the second week is your body's still putting all of its energy towards really kind of repairing and recovering that nose. Um, but now you obviously still have some swelling, which will gradually, fade over the upcoming months, weeks, and months. But how do you feel about your results thus far?
Oh my gosh. Well, let me just pull them up really fast. This was me straight out of surgery, so I will say this is what I'm going to look like, and I am
Yeah.
thrilled with this, and I already look very close to this, I think, other than, of course, a little bit of swelling. But so far, even though I'm swollen, I already see that the shape is exactly what I wanted, and I'm already, like, way more confident. Even when it was, like, the day after and I kinda looked like an eggplant was on the middle of my face, I was thrilled. I was happy
Yeah.
because the shape was a lot better. So, I love my
Yeah.
results already, and I'll show them for anyone who's watching. I'll kinda show this was me at just 2 weeks. 2 weeks. I already had like
Yeah.
pretty much the ideal nose. And then this was me at
Yeah, it looks, I mean,
week
very,
4. Like
yep.
the shape is there already. It's just I got a little bit of swelling. Oh, I
Yep.
did want to mention, this is me when I was little. This is the nose that I was born with, and he gave it back to me. Like, that's my natural nose. Like, you didn't give me some nose that doesn't fit my face. You gave me the nose that I was born with. So I'm just really
Yeah.
grateful for that.
You know, well, no, and I'm so happy that we could give that to you, because it's the centerpiece of your face, a nose, and you can't hide it. And it's something that you're constantly looking at. And, and I tell people this too, because in the initial healing process, it's very stressful because you're constantly looking at your nose, and you can't hide it, you can't avoid it. So those first several months are extremely stressful for a lot of patients, because you want that end result. I personally, as a surgeon, want that end result, but you have to be patient because it does take time. But you're right. I mean, at 4 weeks, in this photo that you have up here, you really already see, the improved contour. You have still some fullness of the tip and the bridge, which I can't wait to see that final product. But I'm happy with where we are now.
Yeah.
And then you showed us that picture of on the table photo, of the before and after. Yeah. Some people don't like to see that. Some people do. I know on social media these days, it's kind of standard to show that side by side. Personally, for me, I do like it in certain scenarios. Sometimes, some people that bruise a little bit more, I'm a little bit more apprehensive to show it. Everybody's different. But can you tell me what your initial impression was or reaction when you saw your side by side?
I started screaming, crying, but in a good way, like of joy. I was so happy. I screamed because it was in the hotel and Sarah was in the other room. I'm like, Sarah, Sarah. And I had her like come in and look. And I was just so thrilled. And I sent it to my family. I sent it to all my friends. I was like, guys, look. And they're like, it's perfect. It's like, I had a couple friends tell me it's
It
like a
is.
little fairy nose. Like, it's just so perfect. And so I just knew right then, I was like, all right, no matter what it looks like when the cast gets off, this is my motivation to take care of it in the healing process and to just trust the process because that's what it's going to end up looking like. And I was super happy.
Yeah. Speaking of the cast coming off, kind of tell me what your initial impression was as soon as we took the cast off. Good, bad, you could just be truthful.
Well, since I work in the plastic surgery industry, I knew what to expect. I knew that like after a week of since surgery that I was going to be swollen. It wasn't going to look anything like it was going to look like later on. But I was already really happy with the shape.
Hmm.
So yeah, I was like, "Oh, it's so swollen." And my mom was on FaceTime. Dr. DeBusk had my mom on FaceTime
Yeah.
looking at me, and she already loved it. She was like, "It's already perfect." And I was like, "It is. The shape is great, but it's a little swollen." But again, I knew
It's
that that
swollen.
wasn't the final result at all. And I was just I remember saying, "I can't wait till the swelling goes down because I can already tell it's exactly what I wanted." So,
Yeah, and I think that it's important, and I stress this, with you and everybody, all patients, how swollen the nose is as soon as you take the cast off. And a lot of people are underwhelmed and, are a little disappointed at times because the tip is not as defined as they want it to be. Even though we talk about it, it's a totally different experience, totally different when you actually experience it. But a lot that the tip is very swollen, especially right when you take that cast off. Now, a month later, there is a dramatic improvement in that tip shape, which I mean, you were able to see even 2 weeks later. Um,
mhm.
so, I mean, do you trying to compare? And I know it's hard to remember what it looked like right away, but do you feel like there was that dramatic change from week 1 to week 4?
Oh my gosh, week 1 to week 2, I saw a dramatic change, and, I've
Yeah.
definitely seen that improvement. It's just like what you said, it's slow, but it's happening, and you told me mine would my final result should be pretty much there at 3 months.
Yeah, I know we're almost there.
Yeah.
You are doing an amazing job. But overall, during and after surgery, did anything surprise you? Was there anything that you didn't expect that you experienced, or anything, like I said, surprising in the post-op period?
Other than just taking it easy, that there wasn't really anything hard to do, and I think that's what surprised me the most. And also, it was really
Yeah,
it was just really comforting to know that I could just if there was anything little that kinda scared me, I could just text you and you would be there because I have your number and you were there. You answered within an hour usually if anything ever happened, which nothing ever happened. It was just me saying something about a stitch or something like that. But yeah, like that
yeah.
was also something I didn't know was gonna happen. Like I didn't know I could just text my surgeon.
Yeah, and I give my cell phone number to all surgical patients. And I know, again, I know one of those taboo things as a surgeon, but for me, it's easier for you if you have questions or concerns to be able to contact me directly. I have not had really anybody that abuses that, and I think by being open and giving it to patients, I feel like a lot of people actually respect it. Um, and you've never had surgery before, but I think you're right. When I give my cell phone out to patients, a lot of them are kind of surprised or dumbfounded that somebody would do that. But if I had a family member having surgery, I'd want them to be able to have direct kind of contact or access to the surgeon, especially when it comes to cosmetic surgery, because this is your face, the middle of your face. I think you have the right to ask if there a question, if there's any major concern. And then, so since the surgery, going back to California and then seeing your family and friends in Ohio on FaceTime, have people noticed the change in your nose? Have they been able to tell a difference in your before and after? Have they made comments?
They knew because I'm a blabbermouth and I told them that it was gonna happen, but they said they all told me, like, "It fits your face so well. You look like yourself. Like, you don't look any different, you just look way more confident." That's what all of them have told me, my family including.
No, it's good. And, I think um, getting that reaction from everybody is important. And then one thing also, because typically for me, my personal preference in seeing patients is, you know, 1 week after surgery, 1 month, a couple more months. But since you're out in California, it's a lot harder, obviously, for us to see each other. We can see each other virtually, but it's still kind of hard to really get a good idea of the healing progress. So you went and saw one of my good buddies, Dr. William Harris, out in Beverly Hills, who's also a facial plastic surgeon. Can you kind of tell us how that experience was? Seeing him, going to his office, taking the photos.
Yeah, that was an easy, like, maybe 30 minutes max process. I was kinda nervous about going. I was like, "Oh, his team doesn't know me. They're gonna be so confused about why I'm showing up." But they welcomed me with open arms. They were super kind, and, he just took really great photos of me, and yeah, it went pretty simple. He and I even he said he does give some of his patients steroid shots to make the swelling go down faster or whatever, and I was like, "Be honest, I know I'm not your
Mhm.
patient, and that Dr. DeBusk doesn't really do steroid shots this early on, but if I was your patient, do you think I would need it?" And he said, "No, because my swelling is so not that like, it's there, but it's not it it's definitely going down as expected, like, at a good rate."
Yeah, no, and I agree. And steroid shots for people listening are really good to help kind of reduce some isolated areas of swelling, especially around the tip. But usually like to wait about 3 or 4 months for all the initial swelling to go down before we start exploring or utilizing the steroid shots. And then, for people listening that are interested in rhinoplasty, what would you tell somebody who was thinking about having this surgery?
If the only thing holding you back is, like, being scared or being worried that other people would judge you for changing your face, just just get over it and do it because I was a little nervous at first because I was like, "This is the center of my face," but at the same time, it's the center of my face, so
Mhm.
I wanna fix it. So, I've wanted
Yeah.
this since I was maybe 11, and I'm about to turn 24. So if you're like me and you've wanted it for a long time and you've gone back and forth about it and you think it's not actually possible, at least schedule an appointment with some type of consultation with a doctor, like Dr. DeBusk maybe, who knows what he's doing and has patients' best interest at heart and doesn't give everybody the same nose, gives a nose that fits your face. Just just find that doctor as soon as you can because it does make a big difference on your entire life.
Yeah, and I appreciate that, and I appreciate you, and I really do value uh, you sharing your experience because it's a scary thing, and when people are interested in rhinoplasty or nasal surgery, and they don't have somebody close to them that's experienced this surgery or anybody that can give them, direct feedback, it's kind of a scary process. You feel like you're kind of wandering around, with no real direction. So I think for me, I tell everybody, like we were saying earlier, you need to do your homework. You need to trust and really believe in the surgeon that you choose. If that's not me, if it's somebody else, I feel you want to make the decision and feel like you're not being pressured into choosing a surgeon. Um, and then lastly, I would highly recommend for all people that if you do get a rhinoplasty, that you go with somebody that has a large portion or part of their practice is devoted to nasal surgery because it is complex. And I think that that you have a special and unique understanding because of your profession, but not everybody realizes kind of how challenging even straightforward nasal surgery is.
Yeah, I second that. I forgot to mention to do your research, but that's definitely extremely important.
Yeah.
Definitely just look on Real Self, Yelp, read all the reviews from patients and meet with them in person. And if you feel like you need a second consultation, do it. Meet with multiple surgeons if you think you need to, and look at before and after photos. If they don't have any, I wouldn't go to them.
Yeah.
So,
Yeah.
yeah, just definitely do your research. I second that. Sorry about that.
But keep sharing your photos with us to update us on your progress kind of throughout this whole healing process. And we'll drop your latest photos in the show notes. I want to thank you, and I can't wait to see you at your 4-month follow up.
Can't wait to see you there. But thank you so much for
Of course, it's
bringing this to life.
no, it was my pleasure, and again, I do want to thank you for choosing me to be your surgeon. It really is. An amazing thing as a surgeon when patients do to decide to sign up. But I want to let everybody know they can check the show notes for links and how to reach us to schedule a consultation, or if you have questions about prices, financing, and anything else that's on your mind. We will have Hannah's before and after photos, so check out the show notes to see her entire transformation. I want to thank you so much for telling your story. And again, I look forward to seeing you in a couple months. And I hope you have a really happy holidays and Merry Christmas with your family.
Thank you. You and yours too.